I was a young teenager, and my mom had mentioned that she and myself were going to go to get some free health care. My mom and myself haven't had health insurance for many years, so I needed to get a dentist appointment. My mom needed a dentist appointment. She needed some eye care, so she told me that I was going to go along with her. And we were going to camp out in our car the night before just so we could get a number.
447, 448.
And I kind of thought that that was the silliest thing that I ever heard. I wasn't going to sleep in my car just to go get my teeth cleaned. But other than that, I was also kind of embarrassed and ashamed that I had to do that just to get health care. After a couple of trips, I kind of realized those people there, they weren't there to make fun of me, and it wasn't my fault that I didn't have health insurance.
See how much better it is when I do that?
I kind of regret not appreciating it at the time, you know. My dad was a truck driver. He had his own trucking company, but it didn't mean he and my mom didn't have any health insurance. So once my mom got pregnant, after many years of complications and trying, he decided to go to a job that would provide insurance for the family, which was driving trucks for the coal mines. My sister and I were twins, so we were born very, very early. So there was a lot of complications in that regard, and she quit breathing, and ultimately she developed cerebral palsy. So she has a lot of physical ailments. She does have some mental disabilities as well. To top it off, she was epileptic growing up, so we had a lot of different things that we had to deal with. And my mom was great. She quit her job once she became a mother and then realized that she was going to have to be a 24-hour caregiver for the rest of her life. So they saw a whole other side of healthcare that they never anticipated they'd ever have to.
Mom! She's talking. Where's my vitamins?
Early on, I knew that I was going to have to go to college to be able to provide some kind of financial support for not only myself, but my sister later on in life. So all the complications that my sister faced growing up, I knew that we had so many important players in her overall well-being that I wanted to be one of those for somebody else when I grew up. And once I got to realize what a pharmacist can do, that really was the deciding moment for me that I was going to pursue pharmacy school. I originally went into pharmacy school thinking I was going to own my own independent little pharmacy in some small town, maybe even Lebanon one day. But and I kept with that idea for at least the first 3 years, and then once you get out and you're doing your last year rotations and you're in all these different kind of settings, those ideas change, and they change really quick for me. I didn't know this at the time, and I'm so glad that I chose this school, is because they don't just focus on community pharmacy. They don't just focus on hospital pharmacy. They focus on all these different avenues. So I was very lucky in choosing VCU.
I mean, these people here, these people down through here that can't afford a pack of cigarettes, and they're in here getting $2,000–3,000 worth of work done.
One of the most impactful experiences I had as a student at VCU was being able to come back to the Appalachia region as a volunteer with RAM Mom to provide care to my own community. It was kind of a surreal feeling because I felt, you know, maybe I should be the person who's waiting out in the car to get a number to get health care, but no, I'm the person that's going to be providing the health care. So it made me want to work that much harder to care for these patients, and reminded me that I needed to be their moral support, because maybe some of them were in the same mindset that I was in when I was a teenager getting the care. Maybe they were embarrassed, maybe they didn't want to exactly be there. So the humbling experience, you could say. I also felt like I connected with our patients a little bit on a deeper level than maybe some of the other providers, just because I'm coming back to my home. And hopefully I made them proud as well, you know, because they see a local girl coming back to her community, you know. I feel like pharmacy pharmacists in general have a unique opportunity to act as a primary care provider with a whole team of healthcare professionals, because we do bring a wealth of knowledge regarding medications to the table, and that all falls back on just how closely connected I am to this region. All of these people are from a rural community, really, and I feel that rural communities really lack health care. So just being able to provide some form or fashion of health care to these people is part of my overall goal and why I want to pursue that type of work.
We ain't gonna give you nothing, no way. Go on.